or individuals in your life. So, the idea is for us to, kind of have a dialogue and see what do we already know, and is there something more that we need to still understand, so that we come from a place, like Ashita said, kindness, right? Um, and equip ourselves with the right kind of knowledge, with more relevant and effective strategies. So that's going to be the idea. And I would really love it if you would unmute yourself, ask a question. Please feel free to do that. Chime in the chat box, and Ashita is going to help me to kind of, keep an update from that. Please do that. So I'll just, everything okay till now? Anybody has anything to share? Yeah, we will get on to the, we'll try and answer all your questions today. Okay. And of course, before we begin, I really appreciate, the Outreach Collective for inviting me today. Thank you, Bhakti. I've known Bhakti for many, many years. And
No,
thank you
I'm
for giving.
sorry. You are just underplaying it. She's known me since I was 10. But anyway, yeah.
Yeah, so that's in decades then. And it's been a pleasure knowing her, and I've seen her work, and I really can sense her passion for really making a difference among students. It's not only about, doing the things and getting them the right opportunities, but also uh, being a little sensitive and really probing more and not doing any surface level work. And I really appreciate that. And I have been looking at the Outreach Collective and the conferences they do, and it seems really, really interesting. And I hope I can stay connected with them. So yeah, to start off today, let's see. Okay. Yeah. So when we talk about being different, and if you just Google, right now the society, the community is really playing at, yeah, there is so much need for being different, and let's be different, and let's do different, and let's think different, right? And there's so much emphasis on it. And yeah, would you all agree? There's so much emphasis on being different and thinking different and being innovative and coming up with original ideas, and everything is about, innovation today. And yet, if we have somebody amongst us who is different, yeah, maybe in the chat box, if you all could just tell me, when you see this picture, most commonly, how do people around this person, this individual in yellow, respond? What might they say? How they might react? Can you all put that in the chat box, or if somebody wants to unmute and say something, that also be okay? What might be the common responses? Naughty, attention seeking, wonderful. What else? How might people, respond to them? Stare, fascinating, yeah, wonderful. Odd, absolutely. Any more? Quirky, yes, yeah. Yeah, so possibly we'll think there's this somebody who's doing this to gain attention, or so odd, or so different, not behaving like others. Yeah, I mean, standing out, odd. Everybody's standing in a nice one line, and then, there is this person who's doing a handstand. Abnormal, absolutely. Most people would kind of think like that. And I'm wondering if that person, therefore, might feel that they're being blamed for something, they're being laughed at, maybe they're being, shunned, they're being, isolated. Uh, yeah, yeah, absolutely. So, although our society is saying we want to celebrate being different and we want people to think differently, the minute there is something that stands out, there is so much discomfort around, okay, now what do we do with this kid? What do we do with this person? Right? And that is what we are going to try and address today. All right. So I believe that as in environment, we really kind of say biodiversity is what we are hoping to conserve, right, in the environment around us. And biodiversity would mean that, we have more varied forms of plant and animal species around us, because that's what sustains nature and environment and keeps the cycle going on. In the same way, I think a society needs to embrace diversity or neurodiversity, because we need more different, unique kind of people around us, such that we don't become a society of mediocrity where everybody is at the same level and doing the same thing. Yeah. So I really believe that we really need to embrace neurodiversity if we want to really see some change in the world around us. Okay. So maybe some of us are from the psychology background, and I remember that we had like a subject called abnormal psychology, right? In fact, we still have a subject and a textbook that says abnormal psychology. Interestingly, this term emerged in the 40s, and it was from the Western medical model, which spoke about disability, deficit, something that is, not what should be. Okay, abnormal was something that was, it should be something, but it's not, and therefore abnormal, right? And of course, we've come a long way. But you see, the textbook is still called, and the subject is still called abnormal psychology, right? And sometimes I feel it that this word is gets stuck in our head, and sometimes we operate from this space, right? So I really encourage you to think that while we're talking about neurodivergence, when we really meet a person who's different, who stands out, who's odd, who's quirky, who's weird, how many times are we thinking of it as, oh, it's different or it's abnormal, and maybe there's something missing with this person, so they're behaving like that. Yeah. So, well, and then if we move a little further in decades, we came to this word called neurotypical and neuroatypical, right? I'm sure we've heard of that. Maybe you all can do a thumbs up for me to know if we've heard this word called neurotypical and neuroatypical. Yeah, some of us have heard this word. And so what it meant was, again, neurotypical means a lot of people think like this, right? And so whoever does not think like the majority, they are atypical. They are not, again, we didn't use the word abnormal, but it still meant that it was not normal. It was against the norm, what most people are like. And and then from there we move to this word that we're trying to understand today is neurodivergent, which meant that our brains are wired differently. In fact, it was very interesting for me to look at research which said it's almost like how our fingerprints are different, our brains are wired also differently, right? Because since, of course, we are all different in our genetic makeup, and we've had so many experiences since our birth or even in the prenatal stage, that our brains get wired differently. They start learning differently, they start processing information differently. And although, like fingerprints, a lot of our brains will seem different, you can still say that a lot of brains, majority of brains, are wired in a similar fashion. Again, not same, but similar. And so most kids learn in the same way. And that is why we have schools which cater to most kids or the average kid, which learns in a particular way. And therefore, we standardized our curriculum, our teaching methodology, even mental health policies based on what most people behave, what is normal, what most people think like, how most children learn, right? But neurodivergent is a term that came up with Judy Singer and Harvey Bloom, who kind of spoke, and Judy Singer herself, is from the autism spectrum disorder, and through her personal experiences, she shared that I'm not abnormal. There's nothing wrong with me. My brain just works differently. So it's not about being abnormal, but it's about being different. And I cannot be held responsible if my brain is wired differently. Okay, so why the label? of atypical? Why the label of abnormal? And in the late 1990s, therefore, they really started advocating to reject these labels of abnormality and rather embracing that we are different, and therefore advocating for themselves and how they think and their needs. So this was a little about how things have changed theoretically, but that's what we need to kind of become aware of. Are we changing in how we are thinking, how we perceive people, the language we use? That's what we kind of want to look at a little bit about ourselves. So neurodiversity, therefore, is biological, right? My brain is wired differently. I'm not choosing to be neurodivergent. It's not a choice that somebody makes, but it is how their brain functions. Okay. And these are normal variations among people, so individual differences. And therefore, one is not superior to the other, right? But unfortunately, the society, the school caters to the majority, and therefore it appears that the majority is superior and the minority becomes inferior. Yeah. Have I mean, anybody can chime in, share an experience where they have seen this happen, where majority becomes superior. Anybody might want to share something in this regard?
I'll just go first. I think generally in schools, what we see is you made a very pertinent point that schools are wired to not even cater to the best. I mean, to either ends of the spectrum. They cater to they're wired to cater to the belly of the bell curve, right? And so
Yes.
therefore, it's the average student, whatever that means, and anything that is outstanding is also baffling for schools because, like, say for example, giftedness, right? Supposedly outstanding. And anything that is on the other end of the spectrum is also baffling to schools. And personal experiences, I think I've also been undiagnosed ADHD or whatever for like, and you know it, Sam, you're nodding your head, you know it. Like I've been kind of whatever undiagnosed. But I think I was very blessed to have a school that did not label me as my, and it was all because of my principal, who probably understood well ahead of her time that it was good to accept all kinds of students and channel them in the way that they function best. So my experience has been a little different, and I ended up being the way I am, which is okay a little bit because of her, I think.
Yeah, absolutely. Yeah, and therefore schools or counselors play such a big role, right? So even if, like Ishita said, they don't know her journey would have kind of progressed, right? Because the school gave gave them a hard time regarding that. So I think that if we really look at neurodivergence, that would mean that we would have to customize the curriculum, so the mental health approach, the counseling approach for every individual differently, because no one model will fit, no one thing will fit, because people come, and I'm sure as practitioners you've already experienced this, right? No one strategy fits. We always have to customize and modify and combine strategies and recommendations. Ashita, something in the chat box that we need to kind of look at or bring
So
in or
we have one comment where this sorry, Dina, she had an experience in school where she used to write with her left hand, but her school would like hit her on the back of her hand
yeah,
because she was using her left hand. So it was a bad experience, I'm
yeah,
assuming.
absolutely. Out to these kids, because again, handedness is something that is biological and inherent in child. Umbrella of things under it. I have only listed a few. There are many more than the ones I have listed. So there is attention deficit disorder, and then there is attention deficit and hyperactivity. There is learning disability, which is commonly, I'm sure you must have heard of words like dyslexia, dyscalculia, dysgraphia. There's all that falls under learning disability. And then there's gifted and talented, which are again on the other end of the spectrum, that they have the capacity to learn faster, or they also have the they also learn differently again, but then there's nobody catering to their needs, right? And of course, there is the autism spectrum disorder and intellectual disability. And this is not the end of the list. There are many, many more. What we are going to try today and kind of understand is maybe the first three. And we're hoping that this is also one session in a series of sessions where TOC can bring in more experts for us to kind of train ourselves, right? Like I said, even I cannot, kind of vouch for knowing, all the neurodivergences, but I'm going to try and share from the experiences that I've had. Maybe can somebody kind of tell me again, chime in or put it on the chat. Uh, if we are aware of, okay, ADHD, what does that involve? Can you like quickly share the 3 or 4 things that you know of regarding ADHD? Hyperactive, yeah. So what does it look like in people,
Go ahead,
in
Punya.
your students?
Yeah, Punya has raised his hand. Go ahead, Punya.
Yeah, please.
I feel that these students are very, very impatient. They want, like, sometimes I've refused a call from a student and I've got 20 missed calls in 3 minutes, when I've not taken their call.
Yeah.
And those are the signs I've picked on, and I've told parents that, maybe you need to get your child assessed. So that's one. So this is more like hyperactivity. Then they can't be in one place, they can't be focusing too much on, like, they need to keep doing different things. They can't have 2 hour long study periods, so shorter classes, because their attention span is much lower. These are some of the things that I have
Absolutely.
capacity as an educator with kids.
Yeah, very right. And yeah, and therefore, too many thoughts at once, zoning out, difficulty focusing, yeah, everything that I'm reading in the chat box, fighting, they'll get into fights because again, impulsive, right? So I think what you're trying to say, they have impulsive behavior, impatient. Exactly. So again, I'm not going to go into the diagnostic criteria and all that. That is not, the scope of this session, but we need to just get a sense of it. So sure, ADHD kind of falls into that, where we're talking about 3 primary challenges in terms of attention. So they kind of show inattention. They might show impulsivity, right? And hyperactivity, right? So these are the 3 things that they show. Ashta, do you want to kind of add something here?
Yeah. So
Yeah.
also, what everybody has mentioned is a lot of the forward kind of signs that people can see, but there are also a lot of internal signs that somebody can tell you about, like what they're going through. Most of the time, the most common sign is the obsessive thoughts, because you cannot stop those. So hyperactivity, I want to say, is not just outwardly, it's also inwardly. Your mind is moving way too fast, and that can cause a lot of internal conflict. So a lot of the times, as you said, fighting outside, but then those students are also the ones that are really, really fighting inside with their own heads.
Yeah.
So that is also one of the things that, if you have a conversation with someone and they are going through that internal battle and you can see a little bit of the outward signs too, then it's probably the case as well. Because especially in the term of, male and females will often show those internal signs, whereas males will show those outward hyperactive signs.
Absolutely. Yeah.
I want
So,
to add that I've also noticed that sometimes these kids don't perform well in exams. So you see, actually, the attention deficit ones, they're doing very well in the classroom setting. They're pretty smart. When you talk to them, they have it all. But when it comes to examinations, they're not able to put it out there. and you wonder if they're just being lazy or whatever, but it's often that they're not able to focus on an exam for the 1 hour, 1.5 hours, and their attention just goes away, and so they don't perform. So performance, which is lower than what you're seeing in the classroom otherwise in the child, is also an indication.
Yeah, absolutely. And thanks for bringing that up because, and if the teacher is not, observing closely, then these kids are again written off as, intellectually there is an issue, they can't understand, and there is a lot of questions on their ability and competence when that is actually not the case. Yes, Harish.
Sorry, just thought I'd come on camera. Um, Thank you, Samina. I did read somewhere that actually many students, I'm not an expert in this is just based on some of my reading, but I did read somewhere that many students on the ADHD spectrum are actually very creative. And so if there's an ability to harness the strength of theirs, they actually do end up performing really well in fields like the arts, marketing, creative writing. And so
Yeah.
I loved how you opened this conversation about innovative ideas and all that. And I do believe ADHD students are indeed creative and can be very innovative.
And I have met some of those, and they are in my life, and I can see how amazingly their brain can also generate these ideas and the courage sometimes they have to just go and do it, and we are sitting on the sidelines thinking of so many things and analyzing, but they're really out there, and that impulsiveness actually gives them that momentum and that energy. Yeah. And Ashita is also nodding her head, so I guess I'm on the right track. But thank you for sharing. Absolutely. Yes, Swagat.
Yeah, hi. I'm sorry, I just
Hi.
cannot turn my cam on right now. I'm on the road, but I have a question, right? Interesting conversation with respect to multiple personalities. But I have had issues with some very bright students also having substance abuse,
Hmm.
right? I found a very good correlation, right? A positive correlation.
Yeah.
How do we deal? No, how do we deal with that?
Uh, that I think is a very, very specific question, Swagat, and I'm not sure if we can, kind of answer that right now and right away. But because this is really, really related to gifted and their behavior and their challenges. And I'll be happy to kind of take this maybe at the end if we have time. Would that be okay? Can
Sure,
you
I
can
would
we just
love to.
pause?
Maybe if I can connect because I have another meeting, so I'm possibly going to drop in between. But I would love to have this conversation because this is something that
Absolutely.
I've had
Sure.
conversations about, and I would
Sure.
really like a perspective which comes from a professional.
Sure, sure. And we can connect at another time for this. Sorry, I'm not going to be able to take that question in because let's move to, where, we want to for this session. All right. Learning disability. Yes, we're all, Tare Zameen Pe did it for India, I guess, in terms of what is learning disability, and also showed us the positive side of it, or the showed us, how support is required. But again, I would encourage anybody here to share what does that look like. Have you come across what challenges you've seen, experienced by those with learning disability? And it's also with adults, right? Please, let's not think that ADD, ADHD is seen only in school with students and then it somehow disappears, because when you enter college and when you enter the adult world, there seems to be no accommodation, no flexibility, no acknowledgement of these divergences, right? I think, and we would all agree as working professionals, where is that acknowledgement in our professional setups for these divergences, encouraging them, supporting them, harnessing their creative power, like, someone just, I think Hari just said. So let's not think of them only in kids, but also in adults. So anybody would like to say something about learning disability? I'm
I
sure
think
we,
you're very
yeah.
right what you said about adults, because as an IEC, when I'm dealing with parents, I think every third parent that I'm working with has ADD.
Possibly, right? Which is, yeah, because there is a genetic element. So even with giftedness, that's what we come across. A lot of times the parents are gifted, and sometimes it's challenging to kind of get through them and much easier to work with students. But knowing the culture of India, we have to also address parents as much, if not more, in dialogues with the families, right? And we will talk a little bit about that later. Yes, so LD, difficulty with perception, right? So it's about processing of the perception, which kind of is different. Again, for them, I'm not saying it's not normal or there is a problem with that, but it's they just process it differently, right? And therefore, all in fact, I feel this word learning disability has actually come from the education system. They actually don't have a disability. They just learn things differently. So I might be somebody who finds, letters very confusing. But if you give me audio material, my God, I have an immense capacity to learn and to understand, right? But because my school requires me to read the text and write the answers, that's then you label me as disability. So I really, my heart goes out sometimes to these students because we're labeling them because it's about fitting people in the system, right? Yeah, and I see so many people want to share something about that. Please, yes.
I think Swagat and then Harish, and then I'll go ahead. Yeah, go ahead,
Okay.
Swagat.
No, I mean, I already asked my question. I think I didn't lower my hand. I'm so sorry.
Okay. Harish, did you raise your hand again? Or
Yes, I did raise my hand again. Sorry, just coming online again. Um, so Samina, I used to be in the big bad world of assessments, but I have seen a lot of organizations out there. I won't name them here, but these organizations do work very hard on providing accommodations to students. So whether it is, and you gave the example of students not who need time to read letters. So accommodations like providing the assessments with large block letters, or students probably need just some more additional time rather than the restricted whatever 2 or 3 hours that the traditional student has to sit through. So it's very interesting to see a movement out there to support the neurodiverse population of students.
Right, absolutely. So there are accommodations being made, and that's lovely to see. And right now, I see most accommodations being made in the LD part of it, like the learning challenges part of it. And then slowly we are addressing ADHD also in some schools are addressing. And yeah, it's very motivating to see that change. And we still have a long way to go, right? So yeah, so
Sammy, I just
I
want
really,
to chime in. I
yeah,
just want to chime in
yeah,
because, taking from what Harish said and what you said about how students are judged on their ability to read and write. Um, I think this also translates to college admissions, and imagine the how unfair the world of college admissions is, because statements of purpose, personal statements, everything is written,
yeah,
everything. There are only a couple of universities in India, for example, like Kreya and I think Ashoka, that allow a student to submit their personal statement through a video or an image or file or a portfolio, whatever. But we assume that it's only students who want to pursue design who should be able to express themselves creatively through design. But if you're studying STEM or any other subject, you cannot.
yeah.
And Punya, of course, you have a lot of experience in this space, but do we have universities largely globally that accept anything but a written personal statement? Because I'm not aware.
Yes, so there is IE University Madrid, which allows students to put a video essay in lieu of a text essay. And I've had multiple students, some with learning disabilities, which have chosen to do that, and it's worked very well. And then
Wonderful.
quite a few more, which I'm happy to share the list with.
I think that would be great. But would you say that that's not the norm at all, right? It's still a few.
Yes, there's another business school called the Halt Business School,
Mm.
and that was started by a philanthropist from Sweden who who in fact had acute dyslexia, dysgraphia, and ADHD, and he wanted to, as a passion project, to give back to society, to create value for the students. He created this business school, which now even as a pedagogy does not have any examination. Students only work on PowerPoints and case studies to to pass. And even the entire application system is a lot more based on conversation and presentation. And you can do an essay in any format. You can do a podcast, you can do an essay, you can do a video, you can record a voice note and put it, and it's considered as a part of your application.
That's amazing. Punya, it would be very helpful after this session if you could share, like start circulating a list in TOC of universities that do accept alternative methods of self-expression. And I think that would be very helpful for a lot of counselors.
Absolutely.
Thank you. Yeah, over to you, Samina.
Yeah, I think Sapna has been wanting to say something.
Punya, I'm glad you brought that up. I have two kids, full tuition at Hult, and yes, the process is very interesting. I wanted to add about what Harish mentioned. There are two sides of this coin, and I'm sorry, I'm always the devil's advocate everywhere. There are two sides of this coin, right? There are, on one hand, people who are not using the accommodations that are on offer. Because parents, and I deal with those parents a lot, they don't want their child to be typed. They don't want them to be labeled. It's so difficult. You can just tell them that, this will be held against them. But we can see that they have a problem, but they don't want it to be diagnosed because they're like, no, we don't want this test to be done. It's a label. On the other hand, when I was in Delhi for a bit, there were parents. I mean, those children were writing beautifully. There's literally nothing wrong. But please label them as having a disability, because that will get them accommodations. And those accommodations of people who understand that it doesn't cause any problems, but actually makes the child's life very easy, especially in US universities or Canadian universities. They're actually paying a lot to get those labels. So it is a double-sided coin.
Yeah,
just that.
Absolutely, Sapna, very valid point. I think labeling is something that is again is a double-edged sword. We needed to provide the accommodations and support, and yet there is stigma attached to it, because like I have also seen some schools will really do it with the right intention, right? Give these accommodations and flexibility. And some schools are doing it just to tick that box. And even with the accommodation and flexibility, that child still is experiencing isolation and is still being dismissed and is still, done things separately for them, where they're not included really. The feeling of inclusion is not there, and that's when you realize if the heart is in the right place or not for an organization or an institute, right? So yeah, and in fact, it's interesting. Labeling is very interesting for me because that was a part of my doctoral thesis also. Even for gifted and talented kids, sometimes parents are hesitant to get them labeled as that, which might be so confusing, right? But parents are so reluctant that no, it might cause my child to feel superior. And this whole, and I think it's also a very Indian cultural thing where humility is prioritized so much or glamorized so much as a value that we literally, they ask kids to blend in and fit in rather than stand out and be brilliant.
Sammy, sorry, I have to chime in. This is the first time I'm hearing anyone say that humility is glamorized in Indian education, because all our conversations are polar opposite. Because from what we've observed in schools, parents are dying for their kids to stand out and be stellar and be labeled as stellar. And schools are dying to say, oh my God, our kids are rock stars and these are the rock star kids. So this is very interesting.
So that's only for high academic achievement. That is, or being like a sports person, right? I think apart from these two, and I'll add a third one now, technologically savvy and programming and, on that direction, being extremely innovative. I think apart from these three, I don't think parents want the gifted and talented label either. Right?
So gifted
because
and talented,
with gifted also comes the possibility of them being extremely sensitive, highly creative, very determined and stubborn sometimes, extremely emotionally vulnerable, right? And they don't want to do anything with that. All they are focused on, if it is there in the performance and achievement, and how can we use it, of course, to give the child opportunities. But again, it's a very, very lopsided and a very narrow view.
It's also
Yeah.
nuanced. This conversation is very nuanced because it depends on the kind of interactions we've all had. So it's so diverse. But yeah, I mean, it's a good segue into gifted and talented. Go ahead.
Correct. And again, gifted and talented does not mean a high academic achievement, right? In fact, there is no correlation. I have a lot of gifted kids who are average academic achievers, right? But they are brilliant, and I know that because of other characteristics and other behavior that they have shown us, right? And so just and of course there is, like I said, autism spectrum and intellectual disability. I'm sure you all have come across that also. So interestingly, there can be a gifted underachiever who's gifted, who has the potential, but chooses not to perform well. And in the autism spectrum, there can be somebody with autism who's high functioning. So although they have these challenges, but they have this brilliance in a specific area, right? And maybe we've all seen, again, there's stuff in movies that maybe this you can relate to. I remember the old movie Rain Man, and I'm sure there are other movies in the recent times which have kind of portrayed this. So again, I don't need to go through this. We've already kind of looked at it. Yeah, Rupa, you wanted to share something?
Hi guys, can you all hear me okay?
Yes, please
Okay.
go ahead.
Yeah, so I don't live in India. I am a neurodivergent consultant and I work as a psychologist in Canada. And a friend of mine introduced me to your group, and I'm really, really glad I jumped into this meeting. It's been brilliant, absolutely enjoying all your experiences and thoughts and opinions. And, something to just extend, which all of you have spoken about. And I think Ashita raised this topic as well, is a lot of what you're talking, ADHD, LD, gifted, autism. Sometimes people can have all of them under one umbrella or not. But something to also keep in mind is how much they get camouflaged and how different it can get presented. And sometimes that camouflaging in order to fit in, because I want to be accepted in this group. I want, my friends to like me. I want to be a part of this. And with that struggle, a lot of what's beneath the surface doesn't come up. And I think that's what also is a huge factor that leads to not, it's difficult for teachers to pick up what I would call the invisible disability or the special ability, whatever word we want to use. I think that's something to keep in mind as we think about talented, gifted, or learning disabilities, that it's always not visible, and that invisible aspect sometimes is what people struggle with, that segues to depression or anxiety, or we can name 100 things around it. But just a thought that I had, I wanted to jump in and add.
Absolutely. Thank you. Thank you. Yeah.
Yeah, I have something to add on to that actually. So, yes, you brought out a very good point, and we actually call it masking, at least in the Western society. So, masking is like a skill that neurodivergent people kind of get for themselves. Yes, develop in terms of just trying to fit in, blend in, trying to minimize their outwardliness as much as possible. So, it's actually something that I've done too. Usually when I'm talking to somebody, I will mask what they're doing and replicate it and give it back to them. And it's something that I developed as I was a kid because I had hyperactiveness as well, so I had to diminish it a little bit. So it is a very tricky thing to kind of figure out, because a lot of neurodivergent people will do that.
Yeah, thank you for sharing that, Ashita, and thank you, Rupa, for bringing that very, very valid point out. It's not always visible out there. And like I see, even with, and we call that twice exceptionality, when you have the giftedness also, but you can have ADHD with it and LD with it. And then also, I think, what I love about children, they figure also out a way, right? They figure out their own coping ways, just like Ashita was sharing. The only fallout of that is that internally they are really struggling. They're really trying so hard, and they have to really make a lot of effort to cope, right? Because they want to blend in and fit in, and that's why we need to recognize it and acknowledge it and offer the support so that they don't have to struggle inwardly, although outwardly it might appear all okay. Ankit, you wanted to say something.
Yeah, hi.
Hi.
My question is actually related to the coaching industry because I'm from Kota, Rajasthan. So, and I have myself worked for around more than 8 years. So, what I have observed is most of the parents, the problem in India is most of the parents whose children are academic wise, if they score always throughout their academic, they scored above 90%. So, somehow there is some mindset problem is there that it's a kind of, you can call it, they have the fixed approach or a fixed mindset that they said, ki, my daughter, my son will go to PCM. And if they have daughter, my daughter will being a doctor, and they only decide themselves. They never ask whether they are gifted to achieve those aims or to fulfill they want to achieve those. They might be gifted in some other fields. So that is the problem which because of which the student has to feel a lot of student goes through a lot of pressure, what I have observing, and it is still the condition is quite same. So how
Yes.
to control it, and how as an independent counselor or as a school counselor, what extra we can do to cope up with such kind of situations and make parents understand that what's good for their own children.
Right. This is a pertinent question, and though we've seen like a minuscule change right now, but majority of parents are still kind of with this attitude. I think that's why we need to do more such dialogues and have more such platforms, not only amongst professionals but amongst parents, amongst the community at large, where we talk about this and acknowledge this and have empower people like Ashita to share their personal narrative, right? Because unless we hear their stories, uh, then not, I mean, something moves inside us when we hear the first-hand experiences, right? And we need more people, therefore, to first-hand share their experiences and advocates like us, right? That's why we're here today, and you have taken time from your schedule to be here today, and that is the first step towards bringing that change. It is going to be slow, but I do see a ray of hope. I do see some parents backing off. I do see some parents acknowledging that there is saturation in the engineering industry and they finally see it. But moreover, it's still pushy. The parents are still pushy in India, and I know that. And the more brilliant the kid, the more the pressure, unfortunately, right? So yeah, the challenges, and why are we talking about this? Because of course they face challenges, and some of the very obvious challenges we've already kind of discussed. While we discuss the particular neurodivergences, you're going to see that they have challenges in academics. So either their performance will be inconsistent. You might see, they're able to do a particular subject very well, and then there is really marked difference and disparity in their scores in the subjects. Small things like turning up on time for a meeting with you as a counselor, right? Or if you've told them to do a small thing and come back the next time and they have forgotten about it, or they say, "Oh, I forgot about it," and it seems to be repeatedly happening, right? Uh, because there is a challenge with self-regulation, with planning, with prioritizing. So these are really some of the challenges that they kind of experience. And of course, we already spoke about being isolated and the label. And so there are a lot of social challenges. I know a lot of even say extremely brilliant, gifted kids, um, or kids with again hyperactivity, which have trouble with social situations, right? They might not, they want to interact with people, don't know how is the most amicable way to do it, right? Or they are awkward, right? Because they're not sure, because every time some people are having conversations, they have a very different take on it, right? Because they're processing information differently, and they're like, "Oh my god, but nobody is thinking like that. Should I really say this, not say this? What will people, will they misunderstand me?" So a lot of social challenges can also come, especially like somebody mentioned that it really depends on the teachers, how they kind of bring it out in the classroom, and that will decide the tone of the students and the peers, right? I think Ashita, you said it in the beginning. It's really about the teacher and how she talks about this in the classroom for the classmates to follow that, right? Sensory issues, right? We also have sensory processing disorder, which is something that find I mean I'm still to find too many experts in India on sensory processing. But yeah, they might experience heightened sensitivity. So too bright lights, too many noises, it's chaotic, they're not able to have a conversation with you. So it's very important for us as counselors or people who are supporting or who are trying to understand neurodivergence that we are aware of this so that we know have we really designed a conducive environment for us to interact with the student, right? Like I said, I know of students who've told me that today I'm really feeling too triggered. Can you like just can we talk in like more lower tones because I can't take it. I can't take the sound anymore, or I can't talk to you today because of this construction thing that is happening here and I just cannot function. And so can we reschedule the meeting? And this is a real experience. It's not like they're making an excuse or they're just acting out or doing the attention seeking, but this is really their inner experience of the challenges that they face. And therefore it's important for us to know. And of course we spoke about stigma and isolation, and the last one is in how they perceive themselves. Again, Ashita, would you like to chime in something here for us?
Yeah. So one of the main issues that I've seen, at least that I and a lot of people that I've talked to who have had ADHD, undiagnosed ADHD at least, have gone through, is that you're not able to do the normal functions. And it's not because you don't want to do them. It is just because you're unable to do them for some reason or another, for some thing that's going on. Maybe you're not interested in that particular topic, but you have to study it for school, but your brain doesn't understand that. It's only interested in things that are kind of giving you that dopamine, because dopamine is what's lacking. So a lot of the times, because you're stigmatized by society, because you're shunned by society for not performing up to par with everybody else, you start to wonder if there's something wrong with you. Why aren't you able to do this even though you want to do this? So there's a lot of guilt that is associated with it. There's a lot of self-hatred that is associated with it, and it takes a long time to kind of get over that. I did have a student as well who was shunned by society, was shunned by his friends, and he was really alone. And so all he wanted to do was like jump off a cliff, honestly. So it's that feeling, that very intense feeling, because rejection is very sensitive in this community. So those feelings are very important. And kindness, as I said, and as Samina said, is extremely vital. Kindness, forgiveness, being supportive, it's okay. Things are not happening, that's fine. You want somebody to talk to, you talk to me, it's okay. So that's really the attitude that you need to have. A lot of my professors in the US actually had that attitude. I was really bad in class. I wasn't doing my assignments on time, but they took out time and they're like, hey, you want to meet with me once a week? And I was like, yes, for sure. So we sat down together and we would talk about anything and everything. But there were people there that were supportive to me. And that kind of made me want to try a little bit harder, try to fight a little bit more, try to really figure things out, and also ask for help. So if I know that I'm meeting this professor once a week and I can bring up things, one day I can just, while I'm talking to him, just mention that, I'm really struggling with this assignment. And he can be like, okay, we can work on it together. So it's really that supportive atmosphere, that kindness, and that, just that loving nature that can really change the experience of the person. Because it's not that they don't want to do it. They're not doing it on purpose, really not doing it on purpose. But it's just, you cannot fight certain things.
Yeah. Yeah, it's such beautiful anecdote, Ashita, and what a wonderful professor, right? To keep that door open for you, then to kind of allow you to ask for
Yes.
support, right?
Mhm.
And that is really beautiful. And I can see the pain with which you're saying that we can't help it, right? Because there's
Yeah.
so much of misunderstanding and there's so much of judgment that is kind of made for people with neurodivergence, which really affects their self-image. Like you said again at the beginning, they might start thinking there's something wrong with me because most people seem to be doing okay and they're doing wonderfully. And what is it with me that's not working out? And that can really affect their self-image. And imagine if this kid, we are kind of preparing them towards higher education opportunities. It's so tough for them to therefore make a choice and to answer a simple question as what are you good at or what do you like, right? Because there's so much experience of challenge and rejection and labeling that it's so difficult to even find the courage to utter maybe this, maybe I'm good at this, I'm not sure. But and therefore, counselors need to be even more open, empathetic about it, and also talk about this openly. And we'll get to that in a bit. Yes, Rupa.
First of all, I just wanted to thank Ashita for bringing up these points. I hear that a lot in my clients who are adults getting out of college or getting into university, a lot of that shame and hatred and isolation and rejection. And something that I've been working, Samina, is that internalization exercise. It's really hard to sometimes cut across that message, especially when you're thinking about a child that's neurodivergent, maybe in middle school or high school, whatever, where they are getting sidelined, and that rejection is happening right at that time, right? So just a thought here again, I don't know how this would apply to the Indian context, and I'm slowly getting my feet wet within this context. Is I've been trying to go to schools, again, this is all in Canada, and I've had some children who are again okay to talk about what is their living experience every day as they walk into school, as they transition into that building, whether it's the hallway hustle, the bell ringing, or the sensory overload, and many more, or the thought of, oh, what if I'm going to be asked to answer this math question, and that sudden spontaneous thought, right? So I've divided some kids into a small group. For example, I may just have a class of grade 7 kids where, let's take John, will talk to the class about what is his living experience every day. And this is not going to make 100% of a change. That would be a magic wand if I wish I had that. But it creates some form of an internalization in a child. And I would really say teacher or a PT teacher or even the admin staff to say, oh, this is what the child's going through, but it's coming straight from the horse's mouth. Not every kid is going to stand up. I've had some kids make a PowerPoint presentation about their lived experience. And honestly, sometimes I just take things like I take 5 computers and I ask all the kids in the class and I say, hey, help me connect this computers, and they cannot. And that's kind of what I talk about, is how every system works differently. And sometimes you need to connect the dots differently, right? So really, I mean, there's a lot of psychoeducation, there's a lot of awareness, and it's a struggle across the globe. It's beautiful to see what you guys are doing, much needed, but that internalization process somewhere has to happen at a grassroots level. Baby steps. It's not going to be a miracle, but just some thoughts there of what could happen at schools. And I think there's some beautiful work happening here. So first of all, thanks a lot to each and every one of you.
And thank you for sharing that amazing experience, that amazing strategy that you do. It's wonderful. And that's what, we are trying to do here, create platforms where people can firsthand share narratives, which really make an impact. So, so as to we're going to fall short of time, we're going to speed through this. So as far as spotting the signs are concerned, maybe when you interact with these kids, you can see some issues in how they process in terms of sensory examples I already gave. They might feel overwhelmed at times, or you might also see these kids seeking certain sensory experiences, right? There's a lot of fidgeting, a lot of like holding on to the desk and really pressing that down, because that's the sensory experience that they need to regulate their their body, to regulate their brain. So that's what you might see. And of course, paying attention, being able to plan, prioritize, things we've already spoken about here. Again, so in your, when you're trying to help a student create their own profile. You might again kind of have challenges to get them to do the work, to get them to finish the work, to really focus on the meeting with them. So all that might kind of, they might also not be able to estimate. So if you say, okay, if you're going to work on this SOP, how much time would you need to do it? Let's schedule a meeting depending on how much time would you need. But that's a difficult question for them to answer, because they really can't make sense of, if they can't do a time estimation of how much time they would need to say write an SOP, right? So there are a lot of these small things that we need to understand and we need to know to kind of impact. And of course, let's not forget the uniqueness of them. So we don't only have to look at the red flags, but we also need to look at if they have laser focus in one area. Then that can also, if you dig deeper, you might also see, oh, they're hiding it, but they're also struggling in these other areas, and therefore they may be neurodivergent. So let us also kind of be open to, how passionate they can be about one thing, how they might interpret situations so differently, and might have a sense of humor, but might be odd, might be difficult for us to kind of get it at the first go. But that is a sign of neurodivergence, because they're processing information differently, they're sensing the world around them differently. And of course, there might be a lot of misunderstanding, a lot of issues with communication. And that's also, again, maybe not a misunderstanding, but you can always kind of deal with that situation, or turn it around in a more humorous way, right? And these are things that you might want to enjoy with those with neurodivergence. So yeah, something that Ashita has been saying, kindness is like the most important thing that we need to kind of bring into our conversations with students with neurodivergence. And and therefore one of the ways would be, how do we address this in our practice? And like we said, it's not only with students but even with parents. So it's really important to see what approach, what intention we are coming from. Like somebody previously mentioned, that it's so difficult to tell the parents to get tested because they're so reluctant for it. That's exactly where we possibly want to change our approach and see, do they have readiness? you know if you tell any parent that, okay, I see a deficit, there's something not okay about your child, it's very natural for any parent to resist that idea, to be reluctant, because it can be so scary, it can be overwhelming, right, for them, because people around them in their families, in the society, are not really supportive for something like this. And so we really need to kind of be aware of their readiness, be aware of our language while communicating this to them. And like I said, I'm not saying that diagnosis should be done or should not be done. It really is about what is the need for it, how helpful it's going to be for this family, for this child, to actually get something tested and a diagnosis made, right? There can be people who live happily without even getting a formal diagnosis if they have support around them, acceptance around them, and they develop their own coping strategies for how their brain functions differently. So it's about approach, language, and strategies that we might need to want to change while we address neurodivergence. I had this, but I'm going to go really quickly. If we had to kind of say, okay, this is not what most people would choose, why are you choosing this? How can we move our dialogue from really making it sound like this is something abnormal that you're doing, to make it sound like, we can acknowledge uh, their choices, or how they are kind of addressing. So what is another way of rephrasing this statement which will not give the connotation of, we think this is abnormal or atypical? Would anybody want to give it a shot, just rephrase this? Yeah, Punya.
I think talk about the positive and talk about the real strengths, the areas, because at the end of the day, if you're not, your a particular faculty or ability is not as pronounced as the other, tell the
Right.
off on a positive note, telling the parent that this area seems to be beyond normal, and your child is shining in this particular area. It's like, for example, in IQ assessments, when the IQ is even higher than the normal range, that means there is some sort of neurodivergence for sure. But the parents tend to take it more positively than saying that your IQ is lower than the normal range. So I hope you get what I'm trying to say. So that's one way. Second, I feel uh, because we live in a country, I'm going to be talking from the context of India, where there's this whole concept of role modeling. And the moment you start throwing some personalities who've had some, different abilities of learning, different sensibilities, different thresholds of the way they respond to different faculties, the moment you throw some names of personalities, parents begin to feel that it's way more normal, and they're more so these are the two things that I use, at least, where I try to compare it to a reality, and I first talk about the positive, then the negative, or the
Great.
deficit.
So that's a strength-based approach, right? Rather than saying deficit, you look at the strength and you kind of work on that. Perfect. And to just be curious, why, what is your reason for choosing this option? To really get a little more understanding of where the parent or the child might be coming from, and not assume. So being curious about their, how is again their brain, why is their brain choosing a certain option, and respecting individual differences in that, right? So tell me more why you want to choose this, so that we can align ourselves with them rather than saying not this or pass a judgment, right? Similarly, again, I'm going to rush through this and just come to this. So there are two types of approaches, right? If you want to pathologize, you're going to say abnormal, there is a deficit, this is a symptom of ADHD, right? If you really use that language, oh, I spotted a symptom, imagine how it's going to sound to the parent or the child. And maybe we want to say, oh, it's a characteristic, right? So even in and of course this is very easy to do, I think, in the gifted and talented domain, where we say characteristics of giftedness, and therefore characteristics of those with ADHD or ADD, rather than saying symptom checklist of ADD and ADHD, right? I think it would make a world of a difference for parents at the receiving end, for the child at the receiving end, to hear these words from us, right? And and therefore saying, because you have these symptoms, you need a treatment. And like Judy Singer said that, I am not, I don't need a treatment. I am not, I don't have a disorder. I'm different. Therefore, I might need support, right? But you can't treat or cure me of my autism or cure me of my ADHD. And maybe I don't even want to give it up, right? Because that's what makes me me, and that's what gives me my imagination and gives me my power and gives me this different way of thinking and processing information. So it's really about us as counselors being aware of, are we able to change our mindset and approach and attitude and language from abnormal and deficit and symptom and treatment, which is how unfortunately we've been trained to look at, this, to respecting individual differences and looking at a strength based approach and looking at characteristics and traits, and therefore offer support. Yeah. So, so in approach, we'll need to celebrate the differences, be curious about them, and also say, oh my God, what an interesting way to think about this. Or I would never have guessed that, this is what you might choose, and tell me more, right? Check readiness for the parents and the child for a formal diagnosis. Check if it is required, right? Again, like I said, diagnosis and labeling should be done only if it is going to help or get them resources or get support. Otherwise, it's really not like a mandate to do it. As long as people around them are sensitive and acknowledge it. Affirming language, like we said, advocate for them. The more we speak about this with our colleagues, with the parents, with the schools, I think more people will start becoming aware. Lastly, collaborate and consult with a specialist. I really think if you have a kid with ADD, ADHD, it would be helpful if you talk to somebody about it and say, okay, Janri, tell me more about these kids. What is their development trajectory like? What kind of options or higher education options they flourish in? Again, I'm not saying that therefore they should only do that, but where will they need support? It will be wonderful to talk to experts and of course upskill ourselves, right? So if there are like I said, there is this saying that if you meet a person with autism, then you've met only one person, because it looks so different in each person. So it's really important to get direct training from experts in the field, and you will find that people have built expertise in each field differently. I don't know of an expert who knows everything about ASD and LD and ADHD. They might have specialized in one, and therefore we all need to work as a team. So it'll be very meaningful if your student is already going to a specialist and you also talk with them and touch base with them to offer the right guidance for the family. So yeah, to end with, next time we see somebody like that, we might say, okay, let me see how they can shine, how they can lead, how they can be different and contribute, in the community, in the society. So yeah, that was the end of it, and let me stop sharing. And my God, thank you for being so interactive and asking so many questions and sharing so much. I am overwhelmed and super excited now.
That was so insightful, but also poignant because of all the sharing. And thank you to everyone who chose to participate online or vocally or just be here through the session. This is just the tip of the iceberg. This session was not meant as a master class in anything. We're all always learning. Um, and I think, given that this is the beginning of a very important conversation, at least in the community that we are a part of, this is, I promise you, not going to be the last of it. We're going to have many more such, and we will go beyond conversation. We are going to start looking at ways in which we can do awareness workshops and reach more schools, more students, more teachers. Yes, Disha, you have your hand up. Absolutely. And so, by the way, we also have an expert here with us. Disha, go ahead. Please introduce yourself and give your comment.
Hello everyone. So I'm a special educator and I've been one for a decade now. I have had the privilege of working in various kinds of organizations, be it schools, be it startups, be it ed tech organizations, and I've had the experience of working with individuals across different ages. I think to start off with, see, I've always wondered why I am in, TOC, because I was just told by a friend that, you should join the platform and, just meet people from, this field. I'm not a career counselor. I've never done it before, but I always felt like someday I hope I meet a student who is, on his way of packing up and going to a college, and I'll be in that stage where I get to, guide him, and maybe that's when this experience is going to come handy. I think what's very important to understand here is, as Samina very rightly said, that labeling is really, really not important. If there's anything I've understood in this 10 years is labeling, or what the diagnosis of an individual is, it's the last thing to be taken into consideration. I think as career counselors, where y'all are seeing kids day in and day out, what's really important is to understand what the need is, right? It really doesn't matter what the diagnosis is. I always felt that as a special educator, the kind of strategies or the kind of teaching and learning techniques I was equipped with in my journey, it's not something that I get to use only with, kids with needs. I get to use them with everyone, whether they are on the spectrum or they're not, or they are, at par with the classroom curriculum. It really doesn't matter. In a generic sense, your experience comes handy with every different individual that you're going to meet. So, never get overwhelmed about the fact, like, how do I identify whether this child is on the spectrum, or what are the signs I should be looking for to understand if he has ADHD, or she has a learning disability. It really doesn't matter. Just take every child as they come in and try to understand where you pick up from and how do you help them, because at the end of the day, we are all just here trying to bridge the gap. We are not here to fix anybody. We are not here to fix anything in a system. We know that there are loopholes. We know that things are missing. And
at the end it's also every stakeholder's responsibility, right? Because when we are on the other side of the table, it's very easy for us to say that, what, parents have this mindset and parents have these expectations and parents work like this. But having been somebody who's been on both the side of the table, I also understand where the learning institutes need to kind of step up and take responsibility. It is a challenge, I think, as career counselors or as people who have the seat at the table. It's very imperative that we work on, convincing or kind of try to work on a format where today every college in India um, should be ready to accept these students through, virtual. I really won't get the technical things of, how the intake and all happens, but it doesn't really have to be in a written format, as we were all talking about. And I think that that's a very important responsibility that we all have, because like we all agree, right, that it's not the job of the student to fit into the existing system, but how can we make the system more accommodating so that, it puts less stress on the parents? Because I'm sure when that's going to be taken care of, a parent will automatically be a collaborator and will not work on a different tangent. So I think that's what my experience says today, that, just learn these strategies and learn these wonderful insights that both the experts have shared today, where you just pick up from here and understand how do we work in a way that is more accommodative and it's not something that the student has to fit into.
Thanks for that, Disha, and thank you for sharing that. We have one question which needs answering, which is Sapna asked if you can suggest some books to learn more about ADHD, especially personal experience-based books. So if anyone has any recommendations.
I think two have been given.
In the chat, yeah, we're putting stuff in the chat.
Perfect.
Yeah.
Perfect. Okay, so there's Gabor, I think it's Mate or Mate, I'm not sure, but it's called Scattered Mind. And then there's Driven to Distraction and Taking Charge of Adult ADHD. All right, great. So I think we're obviously way over time. And I told Samina when she asked me, how long is this session going to be? I said technically 1 hour, but knowing how conversational this bunch is, it's definitely going to go on for another 30 minutes. And I'm so glad it did. I really hope that this has been slightly helpful and has, if nothing, just opened a little bit of a door or a window in your mind to start thinking in that direction, because I think change is something that we are all striving towards, but it's never going to be full. It's never going to be comprehensive. It's never going to be conclusive. It's always going to be evolving, but till we don't start thinking in that direction and being mindful that something like this needs to be thought of and be paid attention to, I don't think we will even get there. So thank you all for being here, and have a great night, and have a great rest of the week. The recording has been done, but maybe we'll just punish people who didn't attend and not circulate it, because it's so easy to say, hey, just give me the recording. No, I'll circulate it to everyone. Thank you, Samina. It's been wonderful. Thank you for putting all this effort together. This is not the last you're seeing of TOC. You're going to be called back, and maybe you and Disha can do some sessions together. So
I
thank
would
you
love
all.
that. This was super
Absolutely.
fun. Thank you. Yeah. And
And
thank
Rupa,
you
you
for
too.
everyone. Yeah.
And Rupa, you too, thank you for sharing your expertise. We'd love to hear more from you. And yeah, have a great night, everyone.
Yes, absolutely. Thank you, everyone. Good night.
Night.